Hello, everyone. I'm Jason Mantzoukas, and I'm excited to be here today to interview Dr. Kiame Mahaniah, a practicing physician and the Chief Executive Officer at the Lynn Community Health Center in Lynn, Massachusetts. I might seem like an unlikely choice as an interviewer, but rest assured, there is a connection here. My father, Bill Mantzoukas, was one of the founders of the Lynn Community Health Center in 1971 and served as its first executive director. I think I've been to almost every physical iteration of the Lynn Community Health Center, so I'm very much looking forward to our conversation.
I am too, Jason. I am too. Most of the time, I'm deep down into the details, so it's sort of nice to present the health center to people from the outside.
Yeah, and I think that's partially what we're hoping to do in this video is get a kind of big picture look at this organization. So the Lynn Community Health Center is categorized as a federally qualified health center. If you wouldn't mind, could you say a little bit about what exactly that means and how does that shape the mission of the organization?
So the federal government has certain rules by which you qualify to be a federally qualified health center. In general, it means that you're an institution that's dedicated to taking care of people regardless of their ability to pay for it. And the second part of it refers to sort of an administrative structure. Your board has to be 51% run by patients.
How did you find yourself here in the Lynn Community Health Center as a part of this organization? What drew you to this place?
Lynn, I refer to it as a post-industrialized, under-resourced, but highly energetic environment, meaning that there's lots of energy, there's lots of good things happening, but there's not a lot of money. I grew up in a very socially active and aware family, and the idea was always that you had to be doing something to improve the lot of the people who had less than you. So I always wanted to work changing a system, helping people who didn't have opportunities, figure out how to help them engage in those opportunities. And I realized as I became an adult that what really attracted me in medicine was serving an immigrant population. And I loved the immigrant population in Lynn. I loved the fact that there's over 60 languages that we serve our patients in. Lynn is a very dynamic city. The leadership of the city is very dynamic. There are resources, there are companies, there are nonprofits.
The idea that you guys are servicing patients using 60 different languages is mind-blowing. Incredible that you are able to service a community that has that much diversity. Do you have a lot of staff inside the Lynn Community Health Center who are from these immigrant communities and represent those languages or those cultures?
Yes. So, Jason, that's actually one of the wonderful things about working at the health center is that there's all these people from all over the world that are in one place working together for one mission. So we have people who speak Arabic, Khmer, Swahili, Nepali, and they're all working at the health center. And it's just amazing to see the faces of our patients when they encounter somebody who speaks their language, who comes from their culture. Around 70% of our employees speak another language. When people hear their language spoken, it's always a benefit. But when there's actually somebody that actually embodies that culture, that language, it's even an extra level of comfort.
Especially in an environment where you feel vulnerable or nervous or anxious about what's going on in terms of your health care, to have that connection must be absolutely incredible. But I wanted to talk about the Black Lives Matter movement. It's been a wild, unprecedented year this year. The pandemic has laid bare many of the deep injustices in our society and specifically in our healthcare systems. How has that impacted the Lynn Community Health Center? How have you guys responded to your community?
We were lucky enough that the health center movement started in the 60s, and it started as a social justice movement. The model of the health centers has always been, let's find people who are being discriminated against. Let's find people who are not able to access care simply because of either the color of their skin or the lack of heft in their wallet. And let's provide that care for them. In the health center movement, we already knew that going in. So we didn't have to do all that work to accept the reality. And the health center has always been a place of empowerment. In terms of Black Lives Matter, we had already started work around racial equity the summer before COVID started. By coincidence, Boston DPH had been running trainings around racial equity and healthcare leadership. Fortunately, we discovered that on the pay side, no issues. There was no discrimination trend. There was nothing there, whether it's by ethnic group, by race, or by gender. But in terms of promotions, we did notice that even though people of color represent about 2/3 of the people who work in the front line, in terms of first-time promotions, so meaning these are promotions that where we promote from our own people to be supervisors, so that first step. In that first step, we were already favoring white employees. That came as somewhat of a shock to us. It's never something we had tracked, right? You don't notice it when you're making these one-on-one decisions, right? But when we looked at it, we're like, oh, okay, so now we need a program where we make sure that we are identifying promising people in the front line, that we're providing them with that kind of support and training so that they can be ready to apply for leadership and managerial positions. Now, there's things that we need to do as an institution to make sure that the wrong things are not happening. But the majority of this work is really internal work at individual level. As an institution, we have to provide the space and the platforms for people to engage in discussion and to really confront themselves. It's not really about confronting other people. It's really about confronting your own thoughts.
How has this year been for you in terms of managing your staff in a way that has been unprecedented in terms of their workflows have changed, how they work have changed, working from home?
So I've been CEO for 3 years now, and it's my first job as CEO. And I would say that this past year has really been a coming of age for me. As a general egalitarian person who's been heavily influenced by Quaker ideas and Quaker thinking from my college, embracing the mantle of leadership has always been somewhat of an ambivalent issue for me. And this crisis really revealed that it doesn't really matter what I think. What really matters is what does the institution need? And sometimes in a moment of crisis, the institution really needs the leader to just say, this is the crystallization of the values that we all share. And this is the direction in which we're moving based on those values, and to be very explicit about it. There is this great worry all the time that I had about the employees and the staff. Psychologically, how are they doing? Spiritually, how are they doing? And I would say that I still worry about that. I would say it's been one of the most stressful moments of my life, but also one of the most formative periods of my life. And I'm sure I'll be looking back at this period for 20 years, 30 years, and sort of deconstructing what happened to me during that period. So it's also been one of the most rewarding.
I'm curious, from where we are now, what are you looking forward to in the coming months? What are you hoping for? What are you expecting? Where's your mind at right now in terms of what's happening right now?
So I'm really hoping that we can continue riding as a society this dramatic wave of wanting to fight against racism and wanting to fight against the historical injustices that we've had. It is my great hope that at the health center we'll be able to design our telewellness at LCHC, and we'll be able to design it so all those components of telehealth actually help address inequities and injustices as opposed to maintaining them. I'm also very hopeful that our work to become an anti-racist institution will mean that we're going to have so many more career opportunities for our staff, that we'll be able to support them. And I'm really hoping that this sense of community that we've had in Lynn, we can continue, that we can leverage that for other issues that are not as in your face, but that do exist in Lynn.
Well, that is the end of our time. Kiame, this has been an absolute delight. Thank you so much for making the time to talk to me. Thank you so much for all of your thoughtful answers to all of these questions. This has been incredibly informative to me. I've learned a lot. If anyone is watching in the audience right now and you would like to learn more about the Lynn Community Health Center, how to support it, what it does, please visit lchcnet.org/donate. Thank you for joining us. Thanks, Kiame, for having me. This was wonderful.
It was a great experience. So thanks so much, Jason.